All right, let's dive right in. You wanted to explore respiratory disorders and how our bodies deal with a lack of oxygen. We're using Dr. Rasha Eldeeb's physiology handout to guide us, and it is full of fascinating clinical insights. We're going to uncover why high altitudes mess with your breathing. And it's not just the thin air thing. Plus, we'll discover the link between cold weather and blue skin, and why you never, ever want to hold your breath during a deep dive.
It is remarkable how our bodies have these intricate systems for getting oxygen to every single cell. But when those systems get disrupted, the effects are pretty dramatic.
Okay, let's start with hypoxia. What exactly are we talking about here?
Hypoxia basically means your tissues aren't getting enough oxygen, even if your blood flow is normal. It's important to remember this is different from anoxia, which means a total absence of oxygen, a situation that's actually pretty rare.
So it's not just the presence of oxygen, it's
Yeah.
about making sure it reaches its destination. That's a subtle but super important distinction.
Exactly. And there are a few ways hypoxia can happen, each with its own set of causes and consequences.
Okay, let's break down these different types of hypoxia then.
The most common type is hypoxic hypoxia. This is when the oxygen level in your arterial blood is just too low.
So the blood leaving the heart isn't carrying enough oxygen to begin with? What would cause that?
Well, a few things can contribute to that. It could be an external factor, like being at a really high altitude where the air literally has fewer oxygen molecules. Or it could be internal, like lung diseases, think fibrosis or emphysema, which mess up the gas exchange in your lungs. Even problems with the breathing mechanism itself, like a weakened diaphragm or if your respiratory center is depressed, say by certain medications, all these can lead to hypoxic hypoxia.
That reminds me of how important breathing techniques are at high altitudes. Every breath has to count.
Exactly. Now, anemic hypoxia is a bit more complex.
Yeah.
Here, your blood oxygen levels are actually normal, but your blood's ability to carry that oxygen is reduced.
Okay, now that's interesting. How does that work?
Think of it as a supply chain issue. Either there aren't enough delivery trucks, that's like anemia where you don't have enough red blood cells to carry oxygen, or the trucks themselves are faulty, meaning your hemoglobin, the molecule in charge of carrying oxygen, isn't working properly.
So even if you have enough red blood cells,
Yeah.
the hemoglobin itself could be the issue.
Exactly. And carbon monoxide poisoning is a classic example of that.
Now, this is where it gets a little scary. Carbon monoxide is definitely not something you want to mess with.
It's dangerous because it binds to hemoglobin so strongly, over 200 times stronger than oxygen. So even tiny amounts can displace a lot of oxygen, creating carboxyhemoglobin. So your red blood cells are basically hijacked, and they can't transport oxygen like they should.
So your tissues are starving for oxygen,
Mm.
even though your blood seems saturated.
Yes. And to make matters worse, carbon monoxide also shifts the oxygen dissociation curve to the left. It's like hemoglobin becomes possessive of the little oxygen it's carrying and refuses to release it to the tissues where it's needed. A double whammy.
That's terrifying. What are some symptoms people should watch out for?
Early signs are things like nausea, headache, and feeling confused. But here's the weird part. Instead of blue skin, carbon monoxide poisoning can actually cause a cherry red flush because of the carboxyhemoglobin. And if it reaches 70% saturation, it can be fatal.
This is good information for everyone to know. If someone suspects carbon monoxide poisoning, what should they do?
The first thing is to get to fresh air immediately and call for medical help. Treatment typically involves pure oxygen or hyperbaric oxygen therapy to force that carbon monoxide out and restore normal oxygen transport.
Good to know. Are there other examples of these faulty truck scenarios with hemoglobin?
Yeah, there's methemoglobinemia. That's where chemicals like nitrites alter hemoglobin, preventing it from delivering oxygen. And then there's sulfhemoglobinemia, where hydrogen sulfide, a toxic gas, binds to hemoglobin and causes similar issues. The takeaway is that hemoglobin can be changed in ways that prevent it from doing its job, even if oxygen levels themselves are okay.
It's amazing how much can go wrong. It's a wonder we function at all.
Indeed. But we have even more types of hypoxia to cover. Stagnant hypoxia, for example. This one happens when blood flow to the tissues is restricted, even when oxygen and hemoglobin are totally normal.
So it's like a traffic jam for oxygenated blood.
Perfect analogy. And this traffic jam can be localized, like a blood clot blocking a single artery, or generalized throughout the body, like what you see in heart failure or shock.
So even with enough oxygen and working hemoglobin, if your heart isn't pumping well or there's a blockage, oxygen won't reach where it needs to go.
Exactly. Finally, we have the most paradoxical type, histotoxic hypoxia. In this case, there's plenty of oxygen reaching the cells, but they just can't use it.
Wait, what? Why would that be?
It's because the cell's machinery for processing oxygen is impaired. Their enzymes aren't working right. Cyanide poisoning is a classic example. It blocks a key enzyme called cytochrome oxidase, basically shutting down the cell's power plants. Depressants like alcohol and narcotics can also interfere with this, but through different mechanisms.
So it's not just getting oxygen to the cells. It's also about making sure they can use it once it gets there. That's mind-boggling.
The human body is a very complex machine, and as you can imagine, the effects of hypoxia depend on how severe it is and how long it lasts.
I imagine severe hypoxia must be the worst.
Absolutely. If your oxygen levels drop drastically, like in a sudden airplane decompression, you could lose consciousness in seconds and have irreversible damage within minutes.
Wow, that's terrifying how fast it can happen. What about moderate hypoxia? What happens then?
It's more subtle, but still serious. It can actually mimic being drunk. Headache, drowsiness, confusion. You might have trouble with coordination, your senses might be heightened, and you might feel nauseous or even vomit.
It sounds pretty rough. How does it affect your heart and lungs?
Initially, your heart rate and output will increase, as your body tries to compensate by moving the available oxygen around more quickly. But if it continues, your blood pressure will drop. Your respiratory system will also kick into overdrive, trying to increase your breathing rate, which can actually cause more problems, as we've discussed.
This is all making a lot of sense now. So how does high altitude cause hypoxia? We hear about thin air, but what does that mean exactly?
It's all about air pressure. As you go higher, air pressure decreases, so there are fewer oxygen molecules packed into each breath you take, leading to a lower oxygen partial pressure.
So it's not that there's no air, it's that the oxygen is less concentrated.
Exactly. Think of it this way. Imagine you have a scoop that can hold a certain amount of oxygen molecules. At sea level, you scoop up a lot. But at higher altitudes, that same scoop collects fewer molecules. They're more spread out. At 10,000 feet, your hemoglobin saturation might only be around 90%. At 25,000 feet, it drops to 70%. And at 35,000 feet, it plummets to a dangerous 50%, which is where you can lose consciousness.
I'm suddenly feeling very grateful for sea level. Okay, so that explains why it's harder to breathe up high. But what about acute mountain sickness? What causes all those other symptoms besides just shortness of breath?
Acute mountain sickness, or AMS, usually develops within 8 to 24 hours after reaching high altitudes and can last for a few days. It's not just feeling out of breath, it's your body struggling to adapt. A whole bunch of symptoms.
But what else is going on besides the shortness of breath?
The hallmark is a headache that just won't quit. On top of that, you might have nausea, vomiting, feel tired, dizzy, and have trouble sleeping, like a really bad hangover.
That does not sound fun. What's actually happening in the body to cause all of this?
One culprit is cerebral edema, which is swelling in the brain. Low oxygen makes the blood vessels in your brain dilate, increasing pressure and forcing fluid to leak into the brain tissue.
So your brain is literally swelling up. That sounds serious.
It can be. A similar thing can happen in your lungs, too, causing pulmonary edema, where fluid builds up, making it even harder to breathe. And then there's alkalosis, where your blood becomes too basic. That happens because your body tries to compensate by breathing faster, expelling too much carbon dioxide, which is slightly acidic.
It's amazing how interconnected everything is. So how do you treat acute mountain sickness?
Rest is super important, and definitely avoid going any higher. Medications can help with the swelling and alkalosis. In serious cases, you might need supplemental oxygen.
So anyone planning a trip to the Himalayas should acclimatize slowly and have a good first aid kit. But what about people who live at high altitudes all the time? Do their bodies ever really adjust?
That's a great question. It brings us to chronic mountain sickness, or acclimatization, the amazing ability of our bodies to adapt to high altitude if you're there long enough.
So if you stay up there, you basically get used to it.
To a certain extent, yes. Over a couple of weeks, maybe 2 or 3, your body goes through some pretty incredible changes to enhance oxygen uptake and delivery.
Okay, walk me through those adaptations.
First off, you start breathing more deeply and frequently, driven by sensors that detect low oxygen. They send signals to your brain to breathe more. Your lungs also get better at absorbing oxygen by expanding their capillaries and increasing blood flow.
So you're constantly trying to pull in more oxygen, and your lungs become more efficient at extracting it. What else happens?
Your body also ramps up production of red blood cells to carry that extra oxygen, triggered by a hormone called erythropoietin. It's released by your kidneys. And the concentration of 2,3-DPG in your red blood cells increases, which helps hemoglobin release oxygen to the tissues more easily.
More oxygen carriers. And they become better at sharing their cargo. What about the heart and blood vessels? Do they change too?
Absolutely. Your cardiac output goes up to deliver that extra oxygen everywhere, and your tissues actually grow more blood vessels to handle the increased flow.
Incredible. A full body transformation. What about those cases where people develop blue skin? That's got to be related to oxygen, right?
You're talking about cyanosis. That bluish discoloration happens when you have deoxygenated hemoglobin in your capillaries. It's a visual sign that oxygen isn't reaching the tissues.
Okay, unpack that a little bit. What causes cyanosis and why does it happen?
It takes a significant amount of reduced hemoglobin, more than 5 grams per deciliter of blood to be exact, to be visible as cyanosis.
So it's not just a little dip in oxygen levels, it has to be a pretty substantial drop.
Exactly. And there are several things that can cause it. Asphyxia, or suffocation, for example, leads to high carbon dioxide and low oxygen levels, which means a buildup of reduced hemoglobin. Even polycythemia, where you have too many red blood cells, can cause cyanosis.
Wait, too many red blood cells. I thought those were good for carrying oxygen.
You'd think so, right? But with polycythemia, there's just not enough oxygen to go around to saturate all those extra red blood cells, so you end up with a surplus of deoxygenated hemoglobin.
That's counterintuitive. So not all hypoxia causes blue skin.
Right, anemic hypoxia, where you just don't have enough hemoglobin. Won't typically cause cyanosis, you just don't have enough hemoglobin to reach that 5-gram threshold, even in its reduced form.
Okay, that makes sense. What about histotoxic hypoxia, where the cells can't use the oxygen they're getting?
Histotoxic hypoxia usually won't cause cyanosis either, because the problem isn't with oxygen levels or hemoglobin, but with how well the cells can use that oxygen.
Interesting. What about carbon monoxide poisoning? We talked about that cherry red flush. Would that mask cyanosis?
Yes, the bright red color of carboxyhemoglobin can definitely mask any cyanosis that might be present. Even something as simple as cold weather can play a role in cyanosis.
Cold weather. Really? How does that work?
When it's moderately cold, your blood vessels constrict, which slows down blood flow. This gives hemoglobin more time to unload its oxygen to the tissues, but it can also lead to an increase in reduced hemoglobin and potentially cyanosis, especially in your fingers and toes.
So your fingers might turn blue because the blood is moving so slowly that all the oxygen gets used up before it gets back to the heart.
Exactly. But here's the strange part. In extreme cold, you might not see cyanosis, even though your tissues are desperate for oxygen. That's because the oxygen dissociation curve shifts to the left, meaning hemoglobin holds onto oxygen more tightly, and that prevents the visual blue discoloration.
Wow, so even the absence of cyanosis doesn't necessarily mean everything is fine. It's a complex interplay of factors.
Absolutely. And when it comes to cyanosis, there are 2 main types, central and peripheral. Central cyanosis means the blood leaving the heart is already poorly oxygenated.
So the problem is happening right at the source. What causes that?
It could be a few things. Congenital heart defects that divert blood away from the lungs, severe lung diseases, or those abnormal hemoglobins we talked about earlier.
And how do you tell central cyanosis apart from peripheral cyanosis?
With central cyanosis, the bluish tint is widespread. Skin, tongue, mucous membranes. The hands are usually warm, though, indicating good blood flow. Interestingly, warming the person up actually makes the cyanosis worse because it dilates the blood vessels, allowing more of that deoxygenated blood to show through.
That's fascinating. So it's almost like a test. Warming up makes central cyanosis worse, but it would probably make peripheral cyanosis better.
Exactly. And oxygen therapy usually helps with central cyanosis because it addresses the root cause, low blood oxygen. You also often see polycythemia, the body's attempt to compensate by producing more red blood cells.
Makes sense. What about peripheral cyanosis? What's going on there?
In peripheral cyanosis, the blood leaving the heart is actually fine. The problem is slow blood flow through the tissues, leading to too much oxygen extraction, and a buildup of reduced hemoglobin in the capillaries.
So the oxygen delivery system itself is okay, but the blood is moving so slowly that the oxygen gets used up before it can get back to the heart.
Precisely.
And what causes that sluggish blood flow in the periphery?
It could be generalized, like in heart failure or shock, where the overall blood flow is reduced, or localized, caused by blood clots or spasms in specific arteries.
How would you distinguish peripheral cyanosis from the central type?
Peripheral cyanosis usually only affects the extremities, so your fingers and toes, while your tongue stays its normal color. And the hands are cold because of the reduced blood flow. Warming the person up actually makes the cyanosis better in this case, because it improves circulation.
So again, how they respond to warming helps tell them apart. Would oxygen therapy be effective for peripheral cyanosis?
Not really, because the issue isn't the oxygen levels themselves, it's the circulation. You won't see polycythemia either, because there's no underlying hypoxia to trigger that extra red blood cell production.
This is all making so much more sense now. Okay, let's switch gears a bit and talk about dyspnea.
Dyspnea is basically just the feeling of air hunger or difficulty breathing. It's becoming really a way of your breathing effort.
So like when you've run up a flight of stairs and you're gasping for air.
Exactly. Normally, we breathe so effortlessly we don't even notice it until our ventilation doubles. Dyspnea usually kicks in when it triples. There's even a measurement for it called the dyspneic index. If it's below 70%, that means dyspnea.
So it's not just subjective, there's a way to measure it.
Right.
What causes dyspnea?
Oh, lots of things. Some are related to the lungs, some aren't.
Give me some examples of those pulmonary causes.
Anything that blocks airflow in the lungs, so conditions like emphysema or asthma, where the airways are constricted, or restrictive lung diseases like pneumonia or fibrosis, where the lungs can't expand fully.
Anything that prevents air from getting in and out of the lungs easily.
Right. Then there are what we call perfusion defects, where blood flow to the lungs is compromised. This happens when there's a mismatch between airflow and blood flow in different parts of the lungs, preventing efficient gas exchange.
So it's not enough just to get air into the lungs. The blood has to be flowing properly to pick up the oxygen.
Exactly. And then we have diffusion defects. This is where the membranes between the air and the blood in the lungs are thickened, making it hard for the gases to move across.
It's amazing how many things can disrupt something as seemingly simple as breathing. What about the non-pulmonary causes of dyspnea?
Believe it or not, anxiety and fear can trigger dyspnea. They can cause rapid, shallow breathing, which can lead to alkalosis and even muscle spasms.
So your mental state can actually impact your breathing.
Absolutely. Anemia can also cause dyspnea, especially during exercise, because your blood can't carry enough oxygen to keep up with your muscles' demands.
That makes sense. Any other general causes we should mention?
Oh, there are tons. Diabetes, kidney disease, thyroid problems. Even something as simple as a distended abdomen pushing up on your diaphragm can contribute to dyspnea.
So dyspnea is like a warning light,
Yeah,
a sign that something might be off.
that's a good way to think about it.
Now, what is orthopnea?
Orthopnea is a type of dyspnea. That specifically happens when you lie down. And it gets better when you sit up.
Ah, so that's why some people sleep propped up on pillows.
Exactly. It's common in left-sided heart failure because fluid backs up in the lungs when you're lying down. Severe SAtes, a buildup of fluid in your abdomen, can cause it too, as can severe lung disease.
So basically anything that makes it physically harder for your lungs to expand when you're lying flat.
Right. Lying down increases venous return to the heart, which makes pulmonary congestion worse if you have heart failure. Plus, the abdominal contents press on your diaphragm, restricting your lungs even more.
Okay, that makes sense. Now, what about paroxysmal nocturnal dyspnea? That one sounds a bit scary.
It can be quite alarming. Paroxysmal nocturnal dyspnea, or PND for short, are sudden attacks of dyspnea that wake you up from sleep, usually an hour or two after you fall asleep.
That sounds terrifying. What kind of symptoms do people experience?
Well, you might have a cough that brings up frothy sputum, mild cyanosis, wheezing, and even bronchial edema and bronchospasm. It's kind of similar to an asthma attack. It's sometimes called cardiac asthma because of its connection to heart problems.
So it's like a heart-related asthma attack triggered by lying down.
You could say that. It's usually caused by pulmonary congestion related to left-sided heart failure or mitral stenosis, which is a narrowing of a heart valve.
Yet another example of how connected the heart and lungs are. What about periodic breathing?
Periodic breathing means you have alternating periods of hyperventilation, that's rapid breathing, and hypoventilation, slow breathing, or even apnea, which is no breathing at all.
So an erratic breathing pattern that cycles between fast and slow, or even stops.
Right. There are a couple of types. Biot's breathing, which is seen in meningitis, has sharp, irregular changes in breathing. Cheyne-Stokes breathing has a more gradual waxing and waning of breathing depth and rate.
So Biot's breathing is more chaotic?
Yeah.
And Cheyne-Stokes is more predictable.
Exactly. And interestingly, Cheyne-Stokes breathing can actually be physiological, meaning it's not always a sign of disease. It can happen after you voluntarily hyperventilate, or if you're at high altitude.
Like those weird breathing patterns you get after holding your breath for too long.
Precisely. But Cheyne-Stokes breathing can also be pathological, meaning it's related to an underlying condition, like heart failure or kidney failure, or even caused by certain medications, like morphine.
So it's important to pay attention to those unusual breathing patterns and get checked out if you need to.
Absolutely. Always a good idea to listen to what your body is telling you. Welcome back to our deep dive into the world of respiration.
I feel like we've already learned so much, but there's still so much to uncover when it comes to breathing.
That's what's so fascinating about these deep dives, isn't it? There's always something new to discover.
Exactly. Speaking of new discoveries, let's talk about artificial respiration. We've discussed what happens when breathing fails, but now let's explore the ways we can assist or even replace someone's breathing when it becomes inadequate.
Artificial respiration encompasses all the techniques we use to help someone breathe when they can't do it effectively on their own. And there are a variety of approaches we can use depending on the situation.
Okay, so what tools do we have to help someone breathe?
Well, for acute respiratory failure, like in cases of drowning or carbon monoxide poisoning, we typically turn to mechanical ventilation with positive pressure.
Right, where a machine basically takes over the breathing process for the person.
Exactly. A tube is inserted into the trachea, and a ventilator, which is essentially a very sophisticated air pump, delivers breaths at a controlled rate and volume, making sure the lungs are properly inflated even if the person's own respiratory muscles aren't working.
So it's like a mechanical lung stepping in to do the work. That's pretty amazing technology.
It's a testament to human ingenuity for sure. For cases of chronic respiratory failure, where someone might need long-term breathing support, perhaps due to paralysis, we sometimes use negative pressure ventilators. You might recognize those as the iron lungs from old photos.
Ah, yes. Those images are pretty striking. How do those work exactly?
They operate on a completely different principle than positive pressure ventilators. Instead of forcing air into the lungs, they create a negative pressure around the chest cavity, which gently pulls the chest outward, drawing air into the lungs.
It's like a reverse vacuum cleaner for your chest. Pretty ingenious approach.
It is quite clever, but of course sometimes the simplest methods are the most effective. In an emergency situation, nothing is as vital as good old-fashioned mouth-to-mouth resuscitation.
Right, where you're literally breathing for someone else. I remember learning that in first aid. Seems pretty straightforward, but I imagine it's a lot harder in a real-life scenario.
It is a basic technique, but doing it properly and quickly can make all the difference. The brain can only survive for a few minutes without oxygen, so those first rescue breaths can be life-saving.
It really highlights how fragile life is
hmm
and how quickly things can change. But it's also incredible that we have these techniques at our disposal to potentially save lives. Let's switch gears a bit and talk about how our bodies handle breathing during exercise.
Exercise really puts our respiratory systems to the test. To understand how it all works, it helps to think about the different types of exercise. We have severe exercise, like sprinting, which is incredibly intense and unsustainable for long periods. And then there's moderate exercise, like jogging or swimming, which is less strenuous and can be maintained for longer durations.
That makes sense. So how does our breathing change depending on whether we're doing a short sprint or going for a long run?
Well, at the start of any type of exercise, your ventilation increases rapidly. That's because signals are sent from your brain telling your body to get ready to work. And those sensory receptors in your muscles and joints, the proprioceptors, are also sending signals to the brain saying, hey, we're moving, we need more oxygen.
So our bodies are basically anticipating the increased need for oxygen before the heavy lifting even begins.
Exactly. It's a very efficient system. Your body stays ahead of the curve, ensuring your muscles have enough oxygen. And then as you continue exercising, your ventilation continues to increase, but gradually, your body fine-tunes your breathing to precisely match your muscles' needs.
So an initial surge in breathing, followed by a more gradual adjustment. What's happening during that second phase?
Your blood gases are changing.
Yeah.
As your muscles work harder, they consume more oxygen and produce more carbon dioxide. These changes in blood gas levels are detected by receptors in your brain and arteries, which then signal for you to breathe more to restore the balance.
So your body's constantly monitoring those oxygen and carbon dioxide levels and adjusting your breathing accordingly. It's a delicate balancing act.
Precisely. And that balance is crucial because even slight imbalances can have a big impact. For example, if there's too much carbon dioxide in your blood, it becomes more acidic, which can be dangerous. This is called acidosis.
So it's not just about getting oxygen in, it's about maintaining the right balance of gases in the blood. It's all about keeping everything in harmony.
Well said. And speaking of balance, there's another factor that comes into play during exercise: lactic acid.
Ah, yes, the infamous lactic acid, the burn you feel in your muscles when you're really pushing yourself.
Exactly. Lactic acid is a byproduct of anaerobic metabolism. That's your body's backup energy system, which kicks in when there's not enough oxygen to meet the energy demands. So your muscles have to switch to a system that doesn't require oxygen. And as lactic acid builds up in your muscles and blood, it makes them more acidic.
So it's like a double whammy. Your muscles are burning because they lack oxygen, and your blood is becoming more acidic because of the lactic acid.
Precisely. And that increase in blood acidity triggers another set of receptors, which signal for increased ventilation. Your body's basically trying to breathe out that excess acid to restore the normal pH balance.
So we've got breathing, bringing in oxygen, expelling carbon dioxide, and now also regulating blood chemistry. It's a true multitasker.
It really is a wonderfully orchestrated system, keeping everything running smoothly. And there's one more factor that comes into play when we exercise: body temperature.
Right, we all know our bodies heat up when we work out, but how does that affect our breathing?
Well, as your muscles work, they generate heat, and your core temperature rises. This also triggers receptors that signal for increased ventilation. You can think of it as your body using your breath to help cool you down.
Like our built-in air conditioning system.
Exactly. It all comes back to maintaining that internal balance that allows your body to function at its best, even under stress.
It's amazing how much is happening behind the scenes every time we work out. So after we finish exercising, what happens to our breathing during that recovery period?
Immediately after you stop, your ventilation drops sharply because those signals from your brain and proprioceptors stop as soon as you stop moving. Your body knows you no longer need as much oxygen.
But I always feel like I'm still breathing heavily, even after I stop running. What's going on there?
That's because of the oxygen debt. Your body has to repay that oxygen it borrowed, so to speak, during the intense parts of your workout. When your muscles were working so hard, they were relying partially on that anaerobic metabolism.
So my muscles were basically running on a temporary oxygen-free energy system.
Exactly. And that's when the lactic acid was building up. So even though you've stopped, your body is still breathing heavily to clear out that lactic acid, restore the oxygen stores in your muscles, and replenish those energy reserves.
It's like our bodies have a cleanup crew working behind the scenes.
That's a great analogy. And that recovery process is just as important as the exercise itself. Some might even say it's more important because that's when your muscles adapt and get stronger.
That's a great point. So we've talked about how exercise impacts our breathing and about the recovery period afterward. Is there anything else we should cover in this deep dive into respiratory disorders?
Well, there's always more to explore, but before we wrap up, I think it's important to touch upon the ethical considerations surrounding artificial respiration. It's a complex topic that often comes up when someone's breathing is failing.
It's a tough question. When do we intervene, and when do we let nature take its course?
It is a difficult question, and the answer is often complex. We have to consider the potential benefits of prolonging life with medical interventions and weigh those against the potential burdens. We have to think about the patient's wishes and their overall quality of life. It's a conversation that needs to happen between patients, families, and healthcare providers.
It's a reminder that even with all the scientific advancements in medicine, there are always ethical and philosophical questions to consider. It's a good point to end this part of our deep dive on. As we delve into the complexities of the body, we should never lose sight of the human element.
Absolutely. It's been a fascinating journey exploring the world of respiratory disorders with you.
Likewise. To our listeners, thank you for joining us on this deep dive. We hope you've learned some interesting things about how your respiratory system works, and maybe even gained a new appreciation for how adaptable and resilient it is. Until next time, keep learning, keep asking questions, and keep breathing. Back again for the final part of our respiratory deep dive. It's amazing to think about everything we've uncovered about how our bodies handle oxygen, from tiny cells to extreme environments like high mountains in the deep sea.
It really shows how interconnected our systems are, right? Breathing isn't just about taking in air, it's linked to circulation, blood chemistry, even the brain.
Exactly. You mentioned earlier how breathing changes when we exercise. We all know we breathe harder when we work out. Can you walk us through what's happening in our bodies?
Sure. Let's consider different kinds of exercise. There's severe exercise, like sprinting. Super demanding on your body, can only do it for short bursts.
Really pushing your limits.
Right. Then there's moderate exercise, like a brisk walk or a steady swim. Less intense, can keep it up longer. The interesting thing is, no matter the exercise, our bodies are really good at predicting when they'll need more oxygen.
So our breathing changes even before the hard work starts.
Yeah. Right at the beginning of any exercise, your breathing rate goes up fast. This happens because of signals from two places. First, your brain sends a signal like, get ready, we're about to work. Then, those proprioceptors we talked about, the sensors in your muscles and joints, they tell the brain, hey, we're moving, need more oxygen.
It's like our bodies have this internal radar, senses we're about to exert ourselves, and gets the respiratory system prepped.
Great analogy. It's called feed-forward control. Your body stays ahead of the game, make sure your muscles have enough oxygen even before they need it most. Then, as you keep exercising, your breathing keeps increasing, but more slowly. Your body fine-tunes it to match exactly what your muscles need.
So first, a quick increase in breathing, then a slower adjustment. What's going on in that second phase?
Your blood gases are shifting. As muscles work harder, they use up more oxygen and make more carbon dioxide. Receptors in your brain and arteries sense these changes, tell you to breathe more, get back to a good balance.
Like a feedback loop. Body checks oxygen and carbon dioxide levels. Changes breathing to keep everything in check. Works without us even thinking about it.
Exactly. That balance is key. Even small changes can cause problems. Too much carbon dioxide in your blood makes it acidic, could mess up enzyme function, lead to acidosis. Dangerous.
So it's not just getting enough oxygen in, it's also keeping the right mix of gases in our blood. A delicate dance.
Well said. And another part of that dance is lactic acid.
Oh yeah, lactic acid that burn in your muscles when you push them hard.
Right. Lactic acid is a byproduct of anaerobic metabolism, a backup system your body uses when muscles aren't getting enough oxygen. They switch to a system that doesn't need oxygen. But lactic acid builds up, makes your muscles and blood acidic.
Double whammy. Muscles burn because they need oxygen, and blood gets acidic from the lactic acid. Our bodies handle a lot.
It is remarkable, and that acidic blood triggers more receptors, tell you to breathe more, trying to get rid of that extra acid, get the pH back to normal.
Breathing does so much. Brings in oxygen, gets rid of carbon dioxide, now regulates blood chemistry too.
It is a multitasker. And there's one more thing that affects breathing during exercise: body temperature.
Right, our bodies heat up when we work out. How does that tie into breathing?
Working muscles generate heat, core body temperature goes up. This triggers receptors, tell you to breathe more. It's like your body's using your breath to cool down, kind of like a radiator.
Our internal air conditioner. Amazing.
Right. It's all about keeping that delicate balance inside, so your body works its best, even under stress.
So much going on when we exercise. What about when we stop? What happens to our breathing as we recover?
As soon as you stop, breathing slows way down. Signals from your brain and proprioceptors stop. Body recognizes you don't need as much oxygen anymore.
So less breathing when we're not working as hard.
Yeah, but you probably notice you're still breathing hard for a bit, even after stopping. It's what we call oxygen debt. Your body's paying back the oxygen it kind of borrowed during the intense part of your workout, when your muscles were relying on anaerobic metabolism.
Like a temporary oxygen-free energy system.
Exactly. And remember, that's when lactic acid was building up. So even though you've stopped, you're still breathing hard to clear out the lactic acid, get oxygen back into your muscles, and refill your energy stores.
Our body's cleanup crew working overtime.
I like that. Recovery is just as important as the workout itself. Some even say it's more important. That's when muscles get stronger.
Great point. So we've seen how our bodies adapt to exercise and recover. Anything else to cover in this deep dive on respiration?
We've covered a lot. One last thing I'd like to mention, we touched on it before. The ethical side of artificial respiration comes up when someone's breathing is failing.
When to step in and help? When to let nature take its course? Big question.
It is. And the answer isn't always easy. Weighing the good of prolonging life against the burdens of medical interventions. Thinking about what the patient wants, their values, their quality of life. Important conversation between patients, families, and doctors.
Shows that even with all the science and medicine, there are big ethical and philosophical questions. Good way to end our deep dive. As we learned about the body, we can't forget about the human side of things.
Very well said. It's been great exploring all this with you.
Same here. And to our listeners, thank you for joining us on this journey. Hope you've learned something new about your amazing respiratory system. Until next time, keep exploring, keep asking questions, and keep breathing.